you can contact me or Arash, and we'll be happy to kind of share the slides, and there's lots of additional information in the notes of the slides. Before going forward, as a caveat, this is supposed to be a presentation that is accessible to people that do not have specific expertise in mental health research. I know that I'm probably speaking to a variety of different disciplines, including engineers, but because we are quite a small group, feel free to raise your hand or just interrupt me if there's anything that is not clear, or just write in the chat, and we can definitely stop and discuss anything that you find that is not hugely clear from the presentation. But moving forward, so as I said, in terms of the presentation outline, I will start by giving you a sort of description of the evidence on the relationship between climate change. We will move into highlighting a few conceptual and methodological challenges in the existing literature, and then we will move into briefly touching on some future research priorities for climate change and mental health. And most of the work that I will be presenting today draws on work we've been conducting in the last couple of years, particularly with collaboration with Dr. Fiona Charlson from University of Queensland in Australia and Dr. Yura Gustinavicius from McGill in Canada. Basically, in comparison with the relationship between climate change and physical health, the relationship between climate change and mental health has received much less attention in recent years. So we actually know quite a lot about the relationship between climate change and physical health, and climate change is impacting a variety of different physical health outcomes, and there is robust evidence to indicate that. So to give you a couple of examples, we have evidence on the relationship between increasing temperatures and humidity and the spread of vector-borne diseases such as dengue fever. We have evidence between certain climate change exposures such as wildfires or sort of air pollution and respiratory conditions, and mortality and during heat waves. So there is quite substantial evidence highlighting the linkages between climate change and mental health. And every year, the Lancet produces a report called the Lancet Countdown on Health and Climate Change that outlines and that tracks the impact that climate change is having on health generally. And also it tracks the kind of the benefits of preventing climate change from impacting health. And in the most recent iteration of this report that is published just before the UN negotiations on climate change, in the most recent report, so Lancet Countdown 2021, there were 44 indicators that were used to track the relationship between climate change and health. And out of all those 44 indicators, only one to date focused on mental well-being specifically. And that is an indicator that we're going to look a bit more in depth later on during the presentation. And that is an indicator looking at the relationship between heat and sentiment expressed online, basically. But I think this gives you a good snapshot of how within the wider literature on climate change and health, the attention given to mental health is actually quite limited and neglected. This is also reflected in the broader academic literature and in the media. So for example, a relatively recent review looked at how since 2007, media reports on climate change and health have increased by 78%, and the academic literature on the topic has tripled, but mental health has remained largely absent from this picture. This has also consequences on the attention given to mental health in policy. So the WHO has a survey that is sent out approximately every 3 years to all its member states and to a number of territories, sort of inquiring about what individual countries are doing to prevent, promote, and address the health consequences of climate change. And in the most recent iteration of this report, which was published during COP26, they basically showed that mental health and psychosocial health was consistently listed at the bottom for inclusion in countries' climate-informed health surveillance systems, climate-informed health early warning systems. So only 13% and 10% of countries included mental health and psychosocial health within surveillance systems and early warning systems. And this is in comparison to other physical health conditions which have actually received considerable more attention and that are included within countries' health surveillance systems and early warning systems. So for example, here I give the example of vector-borne diseases that are actually included, as you can see, up to 39 and 35%. So nearly 3 times more than mental health and psychosocial health. This the lack of attention in comparison to physical health and the lack of attention in policy doesn't mean that there isn't evidence on the association between climate change and mental health. So we recently conducted a scoping review in which we tried to capture all the original evidence published on the link between climate change and mental health. And we then mapped the evidence that we identified on the WHO 5 global research priorities for protecting human health from climate change. So we actually identified 120 original studies published between 2001 and 2021. So that's quite a substantial number of studies. However, when we looked at what those studies were trying to actually do, we saw that the vast majority of studies, so 101 studies, focused on the first of the WHO global research priorities, that is assessing the health risks associated with climate change. So that means that most studies were trying to answer the question of what is the impact that climate change is having on mental health? What is the association between climate change exposures, such as heat, extreme weather events, and mental health? So trying to look at the association between exposure and outcome. And actually very few studies were trying to look at other type of research questions, such as what type of effective interventions can we have to promote, prevent, and address the mental health consequences of climate change? Or also, how can we integrate mental health concerns within mitigation and adaptation strategies? Or how can mental health knowledge improve decision-making in relation to climate change? And finally, we didn't really identify any study looking and trying to estimate the costs related to climate change. So basically, you can see how the literature exists. There is literature out there outlining the relationship between climate change and mental health, but most of it is really skewed towards trying to quantify the impact that climate change is having on mental health. And in this setting, we do have quite robust evidence indicating that a number of climate change exposures, such as heat, extreme weather events, we're associated with a variety of several adverse mental health outcomes. And this is what we're going to kind of focus for the next couple of minutes, is providing you with a bit of an overview of what this original evidence on the relationship between climate change and mental health outlines. So a first kind of clear exposure related to climate change and that might be associated with mental health is extreme weather events. So we know that climate change is leading to more intense and to more frequent extreme weather events. This was, for example, reported in the latest assessment of the Intergovernmental Panel for Climate Change, the IPCC, which concluded that it is an established fact that human-induced greenhouse gas emissions have led to an increased frequency and or intensity of some weather and climate extremes since pre-industrial times. And in this case, we have quite robust evidence that exposure to different types of extreme weather events can have profound consequences on the mental health of individuals, communities, and families exposed to those type of events. So we know, for example, from the disaster mental health literature, including earthquakes, that exposure to such events can lead to increased levels of depression, anxiety, post-traumatic stress disorder, across different types of populations. And this can happen both directly and indirectly, by which I mean directly. An example of a direct association between an extreme weather event and psychopathology could be that when a person lives through an extreme weather event, they might be exposed to traumatic events. So they might think that they're going to die. They might be exposed to the death of somebody close to them. They might be severely injured. And as a result, they might develop post-traumatic stress disorder. So that, for example, is an example of a direct link between the extreme weather event leading to trauma, leading then to the development of post-traumatic stress disorder. However, we also know that extreme weather events can have profound influences on mental health indirectly. So we know that extreme weather events can basically impact a number of determinants that have been associated with poor mental health. So losing one's house, losing one's employment, those are all determinants of mental health that extreme weather events can impact, and that in turn can impact mental health. So extreme weather events can impact mental health both directly and indirectly, and we do have quite robust evidence on this linkage from the disaster kind of mental health literature. And to give an example of an interesting recent study that did a pooled analysis of a substantial number of studies that were looking at the impacts of extreme weather events on psychological functioning. So they basically collected studies that were looking at the mental health consequences of different types of extreme weather events across the world, as you can see from this map, from 1980 to 2020. And they managed to pool the analysis and the data that the studies had together to have a relatively quite big sample size of 61,000 exposed individuals. And they identified that the composite, so the post-event kind of psychological impairment rate following extreme weather events was 23.2%. So basically kind of 1 in 4 people. The study had various sort of limitations. First of all, as you can see from this map, the different colors correspond to different number of studies that were actually entered into the analysis. And you can see that there is a substantial reliance on studies from the US. So more than 30 studies were included from the US versus a number of other countries that only contributed 1 study to the analysis. And you can see that there are also a substantial lack of studies from countries that are more vulnerable and likely more exposed to climate change, such as Sub-Saharan Africa and Southeast Asia, so that the results are quite skewed towards specific geographical situations. And you can also see that there is actually quite a lot of heterogeneity in the level of psychological distress between the different countries. So you can see that it goes from 18.1% in the US up to 95.8% in Thailand. And this is likely a result of the complexities of having to pool together studies that sometimes use different measures. They might use different thresholds to indicate what we mean by psychological impairment, so that there is a lot of heterogeneity in the operationalizations of the psychological impairment, leading to a lot of variation in the rates. But nonetheless, it is an impressive study in terms of providing a sort of global distribution of psychological impairment as a result of extreme weather events. Having spoken about extreme weather events, another climate change exposure that is likely to be having an impact on mental health is temperature and increasing temperatures globally. And again, the IPCC states that human activities are estimated to have caused approximately 1 degree Celsius of global warming above pre-industrial levels. Global warming is likely to reach 1.5 degrees Celsius between 2030 and 2052 if it continues to increase at the current rate. And that was a statement given with high confidence by the latest IPCC report. And here as well, we do have quite a bit of evidence on the association between heat and mental health. And if you're interested, there is this really excellent meta-analysis published recently in Environmental International that basically tries and quantify the studies that have looked at the association between hot weather and poor mental health. And the results of this meta-analysis is that high ambient temperatures and heat waves have been associated with adverse mental health outcomes. And an interesting kind of result is that for every 1 centigrade Celsius increase in temperature, there is an associated 2.2% increase in mental health related mortality and 0.9% increase in morbidity. So to go a bit more in depth with the relationship between heat and mental health, we know that there are a variety of mental health outcomes that are impacted by heat. So for example, there is evidence to indicate that psychiatric hospital admissions and emergency visits for psychiatric disorders tend to increase during heat waves. And we also know that people with pre-existing mental health disorders tend to be more at risk of mortality during heat waves. And while we do have this evidence, there isn't actually a lot of evidence concerning the mechanisms behind those associations. So we know that there tends to be more increased psychiatric admissions, and there is more vulnerability to death and mortality during heat waves, but we don't know why that might be. There have been several suggestions and hypotheses concerning the relationship between heat and mental health. One possibility is that psychiatric symptoms tend to increase and worsen at unusually warm temperatures. The mechanisms here might again have to do with the relationship between temperature and mood. They might also have to do with medication. So certain psychotropic medications sometimes can impact the thermoregulation of the body and have an impact on the way the person perceives heat or struggles to actually realize that they might be dehydrating and so on. So that might be another mechanism that explains the relationship between increased heat and psychiatric symptoms. And another possibility is the fact that we know that heat, anomalous levels of heat can disrupt sleep. And we know that there is a strong relationship between sleep and mood, and that in terms could lead to a worsening of psychiatric symptoms among people with mental health problems, or simply a worsening of psychological distress among the general population. Another mental health outcome that has been studied in relation to heat is suicide. And here the evidence between heat and suicide is actually a bit more mixed. So there are a couple of studies, in particular the study by Carlton in India and the study by Burke et al. In Mexico and the US, that have found an evidence for a positive association between increased heat and increased levels of suicide, both death by suicide and suicidal behavior. But there was a very interesting, very recent study published a couple of weeks ago, of which I'm reporting the infographics here, that actually didn't find a correlation between heat and suicide. So you can see here on the map on the left, so the male and female cases of suicide, in which basically when you see the color yellow, it means that the incidence risk ratio is around 1. So it means that there isn't really an association between the exposure variable, which is heat in this case, and the outcome, which is suicide. So they failed to find an association between heat and suicide. But actually what they found was that they did find a positive association between humidity and suicide at a global level. So you see here that there are a number of countries in darker orange and in red, meaning that there was a positive association between the two variables, and that the more humidity increased, the higher the levels of suicides reported in the countries where. So as you can see, the relationship here seems to be a bit more mixed and possibly dependent on other variables related to weather, such as humidity in this case. So moving, for now, we've really kind of discussed kind of mental health constructs such as, PTSD, depression, anxiety, suicide. But there is also emerging evidence on the association between climate change and a variety of climate-related mental health constructs and climate emotions. And these include constructs such as climate anxiety, ecological grief, solastalgia, and there have been hypotheses that these constructs might be more relevant for certain subpopulations. So for example, ecological grief was a construct that was sort of first studied systematically among Inuit communities. Climate anxiety is a construct that might be particularly relevant for youth. And there are constructs that have been sort of studied relatively recently and that haven't received a huge amount of attention in comparison with the other kind of mental health outcomes we have addressed. And I mean, to give you a sort of very brief kind of quote by a young person sort of describing the emotion of climate anxiety, I've reported here a brief verbatim quotation from Darragh McAlty, that is an Irish activist and naturalist, that sort of describes how he feels in relation to climate change. And I think it provides a nice snapshot of some of these emotions. So to read the quote, he says, "It feels like a ticking time bomb to extinction. The power struggle between huge organizations, economics, development, and the species we share a planet with is growing so out of control that it's easy to become overwhelmed, depressed, and disconnected. I battle with it all the time. Sometimes my heart beats as fast as a dragonfly wing, and my mental health has really suffered because there isn't anywhere to express these feelings of despair. at the inaction. So while these might not kind of fit into traditional understandings of mental health diagnosis, they're nonetheless constructs that are receiving a growing amount of attention in the kind of climate change and mental health area. In relation to this, one quite unique study that was recently published, actually this week, on Lancet Planetary Health, is a study that surveyed climate anxiety globally. So they managed to collect through a VAS quite a large sample size of 10,000 young people aged 16 to 25 across a variety of different countries. So they collected data in 10 countries, both high income and low middle income countries: UK, Finland, France, the US, Australia, Portugal, Brazil, India, Philippines, and Nigeria. And out of all the 10,000 young people, close to 60% of participants said that they felt very or extremely worried about climate change. And more interestingly, nearly half of the young people surveyed said that those feelings of worry and of anxiety about climate change were actually affecting their daily life, were having an impact on their functioning, so on their ability to play, to eat, to study, and to sleep, which is interesting because a lot of the time, the impact on functioning is something that is used to distinguish kind of normal emotional reactions to mental health issues that might require more support and attention. Interestingly, the study also looked at how those negative thoughts and feelings were correlated with perceptions of betrayal and negative beliefs about one's government response. And again, interestingly, they found that the negative thoughts, worry about climate change and impact on functioning were all positively and significantly correlated with feelings of betrayal and negative beliefs about the government's response, highlighting how many of those feelings might actually need to be situated within kind of more systemic and political context of the climate change response. However, I think when we discuss many of these constructs, it's also important that we highlight a couple of kind of conceptual caveats with the evidence to date. So I think one important thing to highlight is that it isn't all doom and gloom, and we actually have quite robust evidence from the disaster mental health literature that most people that are exposed to adversity do not develop mental health problems, but are resilient in the long term. So they're able to cope with their own individual, societal, family, community resources to manage the mental health and the distressing nature of some of these events. And the other caveat is that anxiety, anger, sadness can also be understood as normal and adaptive responses to environmental degradation on a global scale. And there's actually emerging evidence on the relationship between some of these emotions and action and pro-environmental behaviors. So these emotions might, in some cases, not necessarily be pathological and need to be addressed and resolved, but can be associated with adaptive behaviors, such as pro-environmental attitudes. So for example, a recent study published a couple of months ago collected data from 1,011 participants in Germany, and they collected data on their level of climate anxiety using a psychometrically validated measure of climate anxiety called the climate anxiety scale. And they found that their level of climate anxiety was positively correlated with pro-environmental behavioral intentions, and negatively correlated with climate denial. So I think it's important when we discuss, again, the sort of mental health consequences of climate change, that we try and really place the evidence in context. One last point that I wanted to make in terms of the evidence to date has to do with methodological limitations in the existing evidence. And we have currently a piece under review at the moment in which we highlight the quantitative kind of methodological limitations in the literature to date. And we also propose a number of possible methodological innovations in the field of climate change and mental health. And I'm just checking the time, and I'm going to kind of briefly touch on some of them, and you can definitely then ask me some questions about some of these points if you're interested. But in terms of the limitations to date, basically the quantitative evidence suffers from a number of limitations. So first of all, most studies rely on cross-sectional design, so snapshots of a relationship at one point in time. And this means that there is limited often ability to make causal inferences about the impact that climate change is having on mental health. Additionally, many studies tend not to assess possible confounders of the relationship between mental health and climate change. And confounders would be variables that are associated both with the exposure and with the outcome. So for example, socioeconomic status might lead a person to be more exposed to climate change stresses, but also more likely to suffer from mental health problems. And if we don't try and control for socioeconomic status in analysis, we might be looking at spurious associations between climate change and mental health. Similarly, very few studies have looked at the effect modification of variables or a possible mediation to try and understand what the mechanisms behind the relationship between climate change and mental health might be. And also there is considerable heterogeneity in how both climate change and mental health are actually measured. And often there is a reliance on suboptimal measurement of both climate change exposure and mental health outcomes in the literature to date. So to quickly touch on a couple of challenges for the field at the moment, one key challenge is the fact that there is a timescale mismatch when we're looking at the relationship between climate change and mental health. So climate change is something that takes place over long periods of time, so over years, decades, centuries, whereas the timescale of human emotions and human mental health is often much shorter. It takes place over hours, days, months, sometimes years. But that means that it's complicated to match together data on climate change and mental health, and that many studies often are likely assessing the relationship between mental health and weather variability or seasonality rather than climate change per se. And one possible solution to address this is using projection or forecasting studies in which current exposure outcome associations between climate change and mental health are projected into the future so that one's able to cover more time in their analysis and project in the long term what the impact of climate change might be on mental health. And if you're interested, an excellent example of a study that uses precisely this approach is the study we mentioned before from Burke et al. In looking at the relationship between suicide and temperature in Mexico and the US, in which they projected changes in suicide rate by 2050, given projected temperatures under business as usual emission scenarios. And what they found was that unmitigated climate change could result in a combined 9,000 to 40,000 additional suicides only across US and Mexico. Another methodological challenge has to do with attribution. So the first attribution challenge is attributing a specific event, such as an extreme weather event, to climate change. And the second attribution problem has to do with attributing that specific event, attributing the mental health consequences to that specific event. And one set of methods that can be really helpful in trying to disentangle those attribution questions are detection and attribution studies. And we don't really have time to go in depth into the methodological aspects of these studies, but only to quickly mention one very recent study, which is probably the largest detection and attribution study to date, in which they tried to assess the impact of anthropogenic climate change, the climate change caused by humans rather than natural kind of climate variability, on mortality. And they collected data from 732 locations in 43 countries to measure specifically the mortality burdens associated with the additional heat exposure that has resulted from recent human-induced warming. And across all 37 countries, across all countries from which they collected data, 37% of warm season heat-related death could be attributed to anthropogenic climate change. So there isn't to date an example of a detection and attribution study in the field of mental health, but this is a really interesting set of methods that could really help in addressing some of the methodological limitations. And finally, to sort of conclude and touch on a couple of final methodological limitations and challenges, one final issue is the issue of data linkage. So we know that we have environmental data sets that have really excellent granular resolution, both in terms of spatial resolution and both in terms of temporal resolution. So if we look at one of the most commonly used data sets in environmental epidemiology, the ERA5, but in planetary and climate sciences in general, they have hourly data from the 1979 to present on a 30-kilometer grid on a variety of different variables. And for any of you that has experience working in mental health, this is pretty much unthinkable of at the moment in terms of the mental health data that we actually have access to, in terms of having hourly data on a 30 kilometers grid. And so real issue is, how do we link data sets that have different, spatial and temporal resolution? One clear answer is that we need better mental health data. We need better kind of longitudinal studies that allow us to track the impact of climate change on mental health over time and with more precise geographical timescales, but this might be something that will happen in the long term. One alternative is using types of mental health data that allow us to have that more granular spatial and temporal resolution, such as social media data in this case. And if you're interested in this type of approach, the indicator from the Lancet Countdown that we previously discussed used exactly this approach. So they linked 6 million geolocated tweets to the ERA5 datasets to compare how sentiment expressed during heatwave days differed from sentiment expressed during non-heatwave days. And they found that local heatwave exposure was found to significantly reduce positive expressions of sentiment and increased negative expressions of sentiment. Finally, another methodological challenger is the complexity of detecting mechanisms, as we discussed before. And I think I'm just going to skip this and finish with possible future research priorities. So we highlighted the evidence to date, possible methodological gaps and issues with the literature to date, as well as some possible innovations and solutions to those issues. And recently we conducted a Delphi study trying to outline what the research priorities for climate change and mental health to date would be. And again, if you're interested, I can definitely share the publication with people listening. But basically, as you can see, we highlighted a variety of different priorities for a total of 10 priorities. And some of them are about kind of quantifying the full range of mental health impacts, understanding factors that might increase vulnerability and resilience, develop appropriate measurements. That was something that we touched upon before and that is really key. Defining, quantifying the causal pathways. So again, this notion of managing to attribute clearly the impacts of climate change on mental health, but also trying to figure out possible interventions that we might be able to implement in the context of climate change. As well as the last priority that is about really trying to understand and quantify the economic costs of the mental health impacts on climate change. And this is my sort of last slide to summarize. We have seen that there is robust evidence on how various different climate change related stresses are having detrimental impacts on multiple different types of mental health outcomes, from extreme weather events to heat. And however, how there are multiple methodological challenges that exist in the literature to date, but then also we have possible methodological solutions and innovations that we could use more in the mental health field. And that finally, we kind of need more research, but not only research looking at the association between mental health and climate change, but also research that is trying to really understand what can we do, how can we prevent, promote, and address the mental health consequences of climate change in the future. So thank you very much for listening to me. I think I've gone a bit over time. But hopefully that still gives us some time for questions. And yeah, Arash.
Perfect. Thank you very much. It started very sad that we are not paying too much attention and enough attention to mental health and as well as climate change. And it's very sad that young people are suffering with negative thoughts and stuff. It makes sense, all of these advertisements and stuff, that world will come to end. it will definitely have mental issues. As usual, the floor is open. Whoever wants to ask any questions, if you write your questions in the chat as well, I'm sure Alessandro can read them and answer. There is a long one over there I can see. We recently started the research at UCL with UNICEF to map out the impacts of climate change on children's health in sub-Saharan Africa. There are two types of links which are harder for us to establish: the impact of erosion on mental health, e.g. via displacements, the impact of air pollution on mental health. I was wondering whether you had come across studies engaging with these possible connections in your research.
Yeah. Thanks, Laurent, for the question. It's a really good one. So the first issue about the impact of erosion on mental health. So I'm not aware of, at least we didn't come across any literature on the link between erosion and mental health specifically in our scoping review. And to give a bit of background, to date, most of the literature and evidence on climate change and mental health does tend to focus a bit more on the type of extreme weather events. So there isn't as much literature or more type of kind of chronic or slow creeping climate-related exposures such as erosion or sea level rise. And that is a real gap. So we do need to have more research on those type of climate exposures. One possible reason why we don't have that much evidence is that often those slow creeping and chronic type of exposures are possibly harder to measure in epidemiological studies versus a disaster type of exposure. So I'm not aware of work specifically on erosion and mental health. Via displacement, obviously, there is a huge amount of literature in that case on migration and mental health, of which you're probably aware. The answer for the impacts of air pollution and mental health, I think, is more positive. So there is more research on that, on this relationship. So there's an excellent meta-analysis by Isabel Braithwaite that I can actually share with you if you drop me an email, in which they did find an association between air pollution, anxiety, depression, and preliminary evidence on the association between air pollution and suicide. So in that case, there is more evidence on air pollution, but I'm not aware of anything on erosion, I'm sorry.
Okay, for sure, at least in Middle East, as far as I know, we are facing climate change. There's a massive drop in rainfalls and water conflicts. And because of that, there are forced immigrations, and there are studies of school children, which are forced to migrate from their own city and farms and stuff to other cities. And there's depression as well as suicide among them. On the other side, in Middle East, at least, in the big cities, we're facing with air pollution, massive air pollutions, as well as small debris, which the sand of the deserts are coming to the cities. Again, probably there is a direct relationship between depression and the efficiency of like how people are working and stuff with the pollution, which is, again, sad. If anyone has any questions or any comments, feel free to unmute yourself or write it in the chat as well. But personally, your personal opinion, again, it's very hard to like predict, but do you think with all of these advertisements, all of these stuff that like nations are getting involved, politicians, powerful people are getting involved, do you think we have a brighter future, or we are doomed and we're going to a darker ages?
Yeah, I mean, I think it was an interesting point, especially also when you were talking about the association between kind of more involvement and more communication about the real threat that climate change has on our lives, and how that might actually impact mental health. And I think that's a real kind of, and that's definitely something that we identify as a research priority, is, you know, how can we ensure that we have communication concerning the risks of climate change that on the one hand sort of pushes people into action, and that doesn't deny the fact that, you know, climate change is a very real thing that can have devastating impacts on communities, but at the same time is a communication that doesn't lead people to just spiral in kind of very pessimistic and in mindsets that don't really maybe allow them to kind of react and to engage in trying to make sure that that climate change is something that can be addressed across different levels. So in terms of my personal perception, I mean, I think the evidence is that, you know, there is space for addressing, if we're limiting as much as possible the impacts that climate change might have on communities. And also, I guess the cautiously positive attitude that I might have is also backed by a degree of evidence from the fact that, having worked across disasters, armed conflict, and different types of stressors, we know that the majority of people actually is capable of being resilient and being resistant to the many stresses that they endure in their day-to-day life. That we don't end up having, you know, 95% of people with depression or 95% of people with PTSD. People that develop more severe mental health problems tend to be a minority of the population that require support and that should receive attention, but that also the vast majority of the population will recover with their own coping resources at some point. So I think there are, yes, kind of data-driven reasons to be relatively cautiously hopeful, I guess, about the future.
Okay, that's good to hear. Hopefully social media will help it as well. I have another question as well. So in the last 2 years, I'm sure there has been like lots of mental health issues related to COVID, lockdowns in different areas. When you guys do the surveys, how do you understand whether these are related to COVID or climate change, or is it a mixture? Because is it clear from the survey, from the human being, that, okay, I have these issues and it is because of climate change, or they won't realize it? COVID might be a little bit more apparent that, okay, I'm locked in the house, so I'm not happy. And the mental health issues like continue. But climate change is like much harder to realize and measure as well.
Yeah, absolutely. So that's a really excellent question, and something that is a real issue for kind of mental health researchers. And it's about, you know, how do you attribute a specific mental health sort of outcome to a specific type of exposure. So one way in which that can partially be addressed is by having data on mental health pre-exposure and post-exposure. So at the population level, you know, if you have data on mental health just before COVID, and then you're able to also measure that same population, say a couple of months after COVID, you might see that there is a change from pre to post. And that might be attributable to what happened. If the only difference between pre and post is that COVID has happened, that is a relatively sort of good way of making that assessment. But the thing is that a lot of the time we don't have pre-data on a number of mental health outcomes. So it is actually very rare, even in disaster studies, that you have data on mental health of people before the disaster has happened. Most of the time, researchers would come in after the disaster has happened, and at that point, you can't really say that what you're seeing is the result of the disaster, because you don't really have the data to show that there has been a difference from when the disaster happened in the first place. But I mean, even when you have pre and post data, it can be really challenging to make the attribution link. To give you an example, so up to now, I've really discussed climate change as the exposure and mental health as the outcome. But actually, you can also see it the other way around, in the way that mental health could, for some people, be an exposure. So for example, if a person lives with severe depression, it might be the case that they struggle to have a job, and maybe their housing situation is not as good as somebody that maybe has a job and that is able to earn more money. And as a result of their housing, they might be more exposed to heat, they might not have air conditioning. So in this case, mental health is the exposure that leads them to be more exposed to the environmental stresses, and as a result of that, possibly, experience a worsening of their symptoms. But the exposure in the first place was the kind of mental health. So even trying to address these issues of reverse causality can be really, really challenging. There are a few studies. So in my slides, my final example was an example that did exactly that. They tried to disentangle and to solve the issue of reverse causality by controlling for genetic risk for mental health problems. But those studies require excellent data sets, can often be done only in settings in which you have the resources to collect this really complex data, and therefore it's often very difficult to actually run them and to have that kind of data available. But in short, yes, there are ways in which you can make reasonably robust arguments and claims about causality, but these can be very complicated to actually do, and they rely on the availability of data that is often very difficult to actually collect.
Perfect. So good luck with that.
Yes. Thanks, Arash.
For sure, climate change is not helping, and we have to find a solution for it. And in my personal opinion, the future is bright, and I'm sure like humans will come with solutions and we'll solve it. It will take some time. If there's no other questions, I will share my screen again. So thank you very much again for sharing your studies with us. And it was very nice having an alumni of UCL back. We will continue the EPICentre seminars after the Christmas break. On 26th of January, we will have Future Resilience Urban Communities in the Era of Artificial Intelligence by Dr. Lee Soon, and talking about New Year. So again, if I don't see you guys this year, Merry Christmas and Happy New Year. And the recording of all of our seminars are, as always, available on our website and YouTube channel. So Dr. Alessandro Massazza, thank you very much again for joining us. And Merry Christmas and Happy New Year. We'll see you next year.
Yeah. Thanks everybody for listening.
See you. Bye.
Bye-bye.